Think about your body a bit like a car. It's got to be looked after. It's going to go wrong from time to time, so you take it to the garage.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
Where are you talking about? Is it the skin of the vagina?
Right there, like a little paper split.
Okay.
Who was it who you hit?
My friend, who's the security guard. He does that thing.
Yeah.
And he doesn't want to climb them and kill her.
What is that, Jones?
At 10:30, Dr. Opong. Opong. O-P-O-N-G.
OK, bye. What can I do for you today?
Right, I don't know how it's happened, but I've cut myself underneath and my testicles are really, really swollen.
OK.
Yeah, it's very, very uncomfortable. I sleep in the nod, yeah. I don't know, maybe there was something in the bed that I didn't realise was in there, I don't know, but it's very, really, really sore. The wife's obviously put some cream around there, but the pain's really, I can't bear the pain anymore.
Swollen and sore, and is the pain constant, or do you get sudden jolts of pain? Describe that to me.
Constant.
An aching pain?
I wouldn't say an aching pain. I feel that I'm going to pass out.
Tell me about when you go for a wee.
It's very uncomfortable when I go to the toilet.
Around your groin, or the testicles, or the penis?
No, the penis and the testicles.
And is it a burning?
It's like a burning pain, but a sharp pain. It's like someone's poking me with something.
All right. What we'll do is we'll examine you and get you to do a urine sample. Do you think you could go to the loo?
Yeah, of course I can. Oh.
Is it tender at all?
So you said you're having bubbling urine?
Yeah.
Come on in, Brian. I'm very well, thank you. What can I do to help you today, then?
Right, I'm starting to be a bit irate, right? I've had a confrontation on Thursday. I filled him in, right? I punched him in the face, and that's made me scared, because I'm not dangerous like that, right? As you know, and you got it on your record.
Who was it who you hit?
My friend, who's a security guard. I'm trying to calm down.
Yeah.
Because it's all my nervous system, from my fingers here to my toes, and especially my head. It's like it's on fire inside and all that, you know what I mean?
So let me just check that I've understood this right, Brian. Yeah. So at the moment you're finding that you're feeling a lot more tense and angry at the moment at the world.
Very angry, that's right.
And you have this tendency to lash out at people when you're feeling that way.
It's mainly frustration, that's right. That's what is causing it mainly.
Okay.
Because
Do you think that mentally you're not coping as well at the moment for some reason? Because ordinarily it's not in your nature to get this angry and hurt people. No. So is something making it a bit harder for you to tolerate people at the moment?
Yeah, that's right, because...
And what do you think that is?
It's because Cameron and what he's doing, really, and all these idiots he's got around him, you know, it's really annoying me. And my mobile phone company, they know I'm blind and all that. They keep sending me text messages, and I can't read them.
Not particularly useful, no.
So I find that's taking the piss out of my disability, you know. You know, and that's it. He does that thing.
Yeah.
And he doesn't want to climb them and kill the
The NHS computer system is absolute crap. I can't get into my computer. It doesn't like my...
No, that's your what you go on at the beginning, isn't it?
Yes, well, that's what I was trying to get in on that.
That's not that one.
Yes, it is. I can't understand starting late.
Now it's doing it. That's your card code.
That's the number I always do.
Yeah, so you're going into it now.
No, we're not. Not yet. Don't be so optimistic. You're not in until you're in, Chris.
All right, so... Yeah, you are swollen, aren't you? OK. I'm just going to lift up to see underneath. Where was the cut you saw?
Just right about here, I think it is. Yeah, right there. Ooh.
Let's get you seated again.
What do you think it is, Doctor?
I think there's probably an infection in your testicles. There's a little bit of blood in your urine, which might be an indicator of infection. So 2 weeks of antibiotics, then you'll see Dr. Ferdinand.
Right.
Obviously, if things get worse in the interim, come back sooner.
Yeah.
Once this infection has settled, we can bring you back and then have a proper examination to make sure there aren't any lumps and bumps that shouldn't be there.
Yeah.
OK, that's your prescription. So let's just see how you get on.
Yep, that's absolutely fine, Doctor.
OK.
OK, then.
All
Thank
right.
you very much.
Mind how you go.
Cheers.
Bye-bye.
Don't touch anything.
No, not until I can see it on the page.
You're in.
No, it's not yet.
It is.
Not yet. Wait.
It's in.
Why does it do it?
I don't know, it hasn't done it for me.
So how are you going to bring yourself down to help you calm down a bit and relax a little bit
Well,
more?
that's why I've come to see you, really.
Yes.
We need something to sedate me or, not to put me out like that,
Yes.
But something milder, if you like,
I was just looking at your medications in the past.
Yeah.
And back in 2011, you took a Lanzapine for a period of time. That's a tablet we sometimes use to calm people down.
Maybe a tablet like that would help, would it?
I wonder. I'm not sure I want to use that now.
With regards to mental health, obviously there are medications which we can use, but I think they are not always the best and first thing which should be turned to. And there are other things that can be done, such as counselling, other therapies, good lifestyle choices like eating well, exercise. These are all things that can have a really positive impact on mental health.
It's frightening, really, in one sense. I don't want to be a nuisance to you and the public. I don't want no convictions or no violence at all in my life. I don't want to shoot someone, like my doctor or anybody.
Well, yes. Say ah for me.
Wide as you can. Say ah. Okay. Say ah.
Look at me.
Say ah.
Good.
Say ah for me.
Look up for Daddy. Show him the back of your mouth. Say ah. Ah. Roar again. Say ah. Okay.
Say ah again. Okay. How are you sleeping at the moment?
Sleeping. I normally go to bed about 3 o'clock. So I'm getting about a couple of 3 hours at night, and that's about it, really.
What's keeping you up till 3 in the morning?
Well, all I'm doing is watching the telly.
Telly's rubbish after midnight, though.
The TV and all that is a voice, So I feel comfort from it.
Would you say you feel lonely?
No.
No?
No, I'm not lonely, no.
No?
I like my own space.
Okay.
And I like to be on my own.
So you're happy in that respect?
Oh, in that respect, I'm really happy and all that.
In 2010, when you were feeling quite low, you were hurting yourself. How did you harm yourself back in 2010? Do you remember?
Get my knife from the kitchen.
Yeah.
And cutting.
You were cutting your arm.
Cutting my wrist.
Right.
And all that up here.
But you're not thinking about doing it.
And your knees.
You're not thinking...
And your knees,
right.
and stabbing the knife in your leg,
right.
and saying, here, feel that, you twat, you know, feel this, and all this, you know, which is dangerous and self-harm,
yeah.
right, which you shouldn't be doing.
Are you doing anything like that at the moment to yourself? You're not harming yourself?
No, I'm not cutting my arms or putting marks on me. No.
Do you think it would be worthwhile speaking to someone about how you're feeling at the moment and about these feelings of frustration and anger you're feeling?
Yes, I think that would be great.
OK. I can arrange that. I can do that by referring you somewhere called Southbrook Road. They're the Community Mental Health Trust.
Oh, you don't have to be a mental to go there.
God, no. The vast majority of the people who go there actually enjoy pretty good mental health. It's just sometimes some people need a little bit of help.
Yeah.
Nothing wrong with that.
No, OK.
OK.
Well done, mate. It's all good, you know.
Indeed. All right, let's help you gather your things up. Right, Brian.
Thank you very much.
All the best. You're going to be OK finding your way out?
Yeah.
Good. Take care.
Thank you very much.
Bye-bye.
How can I help you today?
I've just got a bit of a lump under my chin. You can have a go on it if you want, it's just there.
Yeah. To me, it doesn't feel like anything sinister.
Cool, thank you.
Come and have a seat. How are you?
Okay.
Okay.
Fine. I feel fine in myself, yeah.
We had some results to go through. Is this why you've come?
Yes.
I hope so. Yes. I tested you for diabetes. No signs of that. Blood count, no anemia. Kidney function, fine. Cholesterol level, now. It's 6.7. The upper end of normal should be 5.
Okay.
It's a measure of the sort of fat that's floating around in your body, and we get excited about it because we know it's one of the big risk factors, fat and blood pressure and smoking, for heart disease. I suppose the first thing to say is, what's your diet like? Vegetables.
Yeah.
Vegetables and fish.
Vegetables and cakes.
Got to have some naughty days. You can't say no to cakes completely. But actually, cakes are what we call quick fixes. You get a sudden burst of sugar, but it doesn't last. If you were to take your carbohydrates in the form of something like, say, porridge in the morning, that'll keep you going because it's releasing the sugar slowly. So porridge, cereals, pasta, they're all releasing their sugars slowly.
If only there was a magic potion or something for weight, eh?
Yes, there's no magic wand, is there, for weight? But diet, losing weight and exercise can actually reduce your cholesterol levels.
Yeah, I know exactly what I should and shouldn't be doing, so I'll give it a go and I'll try.
Give it a go. You can actually get 12 weeks of free Weight Watchers.
Wow.
Just think about it.
Yeah, definitely. I can see you.
Okay?
Okay, see you soon.
Good, bye-bye. I hope she does something about it.
All right, so that's 5 o'clock then. Okay, thank you. Bye-bye.
I've got my thing tonight, innit? My Weight Watchers start tonight.
Excuse me, please.
This is my area. I can't breathe.
That's why you go Weight Watchers.
Oh, leave me.
And my stomach, yes, most times there's pain in me. Yeah.
Do you get any feeling like being sick, vomiting?
No, I just feel pain. I'm feeling pain.
How's your weight been?
My weight is all right.
Yeah. And how about your appetite?
Yeah, it's okay.
Any diarrhea?
No. Blood coming out sometimes.
Blood?
Yeah.
Is it in the toilet bowl, the blood?
No.
So it's only when you're wiping?
Yeah.
Yeah. Because of the symptoms you're having, would it be okay for me to examine you?
Yeah.
So I need to check your stomach.
Yeah.
The other thing is because you're having bleeding from your back passage.
Yeah.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
No.
Okay. Now I'd need to take a look at your back passage. And obviously I'd have some gloves on. And then using some gel, I would examine your back passage with my finger.
No problem.
Okay. Are you okay for me to do that?
That's fine.
you want a chaperone? Are you happy for me to go ahead? Do you want someone to chaperone while I do that exam?
Yeah.
No, do you want someone to be in the room whilst I do that exam?
That's all right.
Okay, so first I'm just going to take a look at your stomach.
Okay.
For all intimate examinations, we would offer a chaperone to people. Because quite often your patients might come to practice with a range of different symptoms and they wouldn't expect to do a personal exam because that's maybe not what they had in their mind. So I'm just going to gently press. Just a sec. Lie on your left-hand side, yeah? And then let me know when you're ready.
I have to take my trousers off, yeah?
Well, you can just lower them just so I can see your back passage, essentially. Tuck your knees up towards your chest. I wouldn't say it's difficult to do an intimate examination because it's something that you do throughout your training, so you do get used to doing intimate examinations. And that's why it's important that you're reassuring the patient that this is actually quite a normal thing and there's no need to feel awkward about it. Okay, so I'm just applying some jelly to your bottom end. It'll feel quite cold. And now I'm just gently advancing my finger through.
Yes.
Okay, so if you want to get dressed and then come back outside.
Okay.
Yeah.
I don't know what's causing that blood sometimes.
You've got a pile, which is what's causing the bleeding. Have you heard that term before, hemorrhoid?
That's what I was thinking.
Okay, so around your bottom end, you've got quite a lot of veins there. They carry blood, essentially. So sometimes when people get symptoms of, say, constipation, as such, have you felt constipated yourself?
Yeah.
You have been? Okay. So I can give you symptoms of bleeding. So there are different things you can do to try and help those symptoms.
Yeah.
One thing is eating more fibre in your diet. There are some creams that I can prescribe for you that you could apply to your back passage to try and help those symptoms as well.
Okay.
Okay. Yeah.
Hello, this is Dr. Ferdinand calling from St John's Medical Centre. You know, we took a couple of urine samples from you last week. They came back negative for chlamydia and gonorrhea, so there was no evidence of those.
I can't sit here and tell you that you definitely don't have prostate cancer, but at the same time, you're within normal range now, which is fantastic. You brought that right down.
They did a lot of random biopsies, and your IBS-like symptoms are just IBS. They're not colon cancer.
That's fantastic news. Thank you. Thank you.
We're in business.
Yeah, it's normal. Okay, thanks. Bye. It's normal. Your chest X-ray is normal.
So, last time I saw you, you had this problem with your toe.
That's right. And I went.
I was a bit worried about it. I asked you to get some blood tests to check for diabetes. And I'm sorry to tell you today that your blood sugar results did come back very high.
Very high. Oh,
okay?
Yeah.
So
it's looking like diabetes.
I'm afraid so. In fact, I'm certain you have diabetes. Mm-hmm. Diabetes is a serious diagnosis because it's such a wide-ranging condition. The fact that the sugars affect your eyes, affect your kidneys, and diabetes is in itself a risk factor for heart disease.
Right.
Yeah, it's not something to be taken lightly, but at the same time, at the age of 60, we've got lots of years, hopefully, to get in control of things.
Type 1 diabetes is a failure of the body to produce insulin, which is a hormone that regulates your blood sugar levels. And type 2 diabetes is a resistance to insulin. So the insulin that you do produce doesn't have the same effect. Undoubtedly, type 2 diabetes is a serious diagnosis, but there aren't many conditions where the patient themselves has so much control over how things will progress and reduce the chances of serious things happening massively.
Now, the way we go about treating that is, first of all, we give some tablets. Mm-hmm. Probably the biggest thing is the things you do in your lifestyle, so diet is absolutely key.
Yes, plus I'm a drinker, so will that be knocked on the head or...?
What do you drink?
Mainly lager.
Okay, I was worried you were going to say that. So, I mean, alcohol in general isn't going to help you.
No, of course not.
But all these alcohols have high sugar content, especially a pint of lager.
I thought that, yeah.
Okay.
I can still work though, can't I?
What do you do for a living?
I work on the construction sites.
Yeah, so
because that's my living. I need to get money.
Yeah, having diabetes is not going to stop you from being able to work on the site.
Yeah.
But you need to also be aware of just what's happening with your blood sugars, because I mean we're talking about the rest of your life, 30 odd years. We need to get this diabetes under control, and it will take you time to manage your diet and to figure out what's bad, what's good. Actually, that's all you need from me in terms of paperwork for now. And I'll give you a prescription now as well.
Right.
We might need a couple of different tablets to get your sugars under control.
Do your fist for me.
Now I've got to pinch an inch. All right? Keep your belly nice and relaxed, okay? Very good.
All right, sharp scratch.
Right. Any allergies to anything that you're aware of?
No.
High blood pressure?
No.
High cholesterol?
No.
Thrombosis, clots in the legs or the lungs?
No.
Diabetes?
No.
Glaucoma?
No.
And breast cancer?
No.
Have you ever had HIV screening?
I think I did, but it was years ago.
Right. Do you want me to do it today?
Yeah.
Yeah? Let me feel your hands. Are you warm? So this is an instant result.
All right.
1 dot is negative and 2 would be positive.
When I had my eyes tested and he's in there saying to me, well, you could do with losing weight. I said, yeah, mate, I'm 66.
Yeah, oh no.
Can't be doing no diets. Mate, no. Nice to see you anyway.
And you haven't seen me for a long time.
I don't come here a lot, do I?
I don't blame you. Take care. See you soon. Bye.
There you go, you've got a nice negative dot there.
Phew.
It's amazing how many people suddenly think when you say to them, oh, it's a test, you can have the results straight away, they go, oh, OK. What, you mean now? What about chlamydia screening? Have you had chlamydia screening recently?
Not recently.
Do you want to do that as well? You can do that yourself.
Okay.
What you do for that is you just go to the toilet, wipe yourself, pop that much into the vagina, and then in the pot.
Okay.
All right, and the toilet's right opposite.
Hi, is it Miss Strong? Hi, please come in. What can I do for you?
I'm here about my coil.
Okay.
I've had in over 5 years.
Okay. Were you hoping to have it taken out today?
No, I want to keep it in.
Oh, right, okay.
If I can.
Fine. I think, to be honest with you, if you've had it in for 5 years, it's better to come out.
I've been fine with it. I've had
Fine. I mean, the last set of blood tests that they did suggested that you might be postmenopausal now, and at 53, I would expect that to be the case.
post.
So, as in, your periods might have stopped now. So, rather than leave this in for a long period of time, more than the recommended time frame, my gut instinct is it should probably come out.
I've had the menopause.
That's what the blood test would indicate.
I haven't got no hot flushes or anything.
Not everyone does get hot flushes. Not everyone finds it difficult. But that's some people. Yeah, the menopause affects people in various different ways.
The hot flushes, I'm not really too bad on that. I might get the one maybe a month, if that.
Yeah, no, I don't get the hot flushes.
So I don't get the hot flushes really and truly. I don't experience that. But what I've noticed with myself is that I'm so snappy.
Yeah, me too.
Bad-tempered.
Yeah, me too. Yeah.
It's like I want to kill anyone who gets... It's not even funny because it's like I have to check myself sometimes.
Yeah,
do you know what I mean?
of course. It's not sure somebody will say to you, why did you do that? And you think, did I?
Don't know
that you did.
It's got to be menopausal.
Was there anything else you wanted to ask about? Was that it today?
What's this up? I know it's like having, my vagina in there. You know the bridge bit, it keeps splitting now and again.
Okay.
Like a paper tear.
Rough drawing, where are you talking about? Is it the back passage or is it actually the skin of the vagina?
Right on the muscle bit in the middle there. Like a little paper split.
Okay. And does it bleed?
No.
Is it just very sore?
Mm.
Okay. Well, that might all correlate to the fact that you might be postmenopausal now. You can get vaginal atrophy postmenopausally, where because you don't have the estrogen going around, the vagina will actually get a bit dry and actually can shrink, and you can get problems there. So I think this is all kind of part and parcel of the same picture, really. My gut instinct is that we take the coil out, we can start giving you some estrogen cream for the vagina that should keep it supple and avoid getting further kind of tears or, irritation, things like that.
Yeah.
Does that make sense?
Yeah.
All right.
How are you?
Not good, doctor. I keep feeling terribly sick, nauseous, and then I get a cold sweat, and then I get a terrible pain across the top of my eye here, just on the one side. The pain don't go away. I've tried every tablet, and it's even to touch it, it's sensitive.
Okay. So when did this start?
I've had it for a couple of weeks now. It's continuously coming and going.
And how would you describe the pain?
It's like a toothache in my head. If you touch it even there, it's so sensitive.
Yes, so it's the pain that you can make worse by touching it.
Just by touching it.
Right, may I check your blood pressure, please?
Yes. Do you know what it is, doctor?
Well, I think it's a migraine.
Oh, sugar, I've never had them before.
Is there anything else going on in your life that you...
I'm just down all the time, constantly. And I'm going today to, what do you call the people, the psychologists?
Yes. Are you worrying about that?
It seems strange, I don't know.
What's your biggest fear?
I just feel that it makes me inadequate if I'm attending something like that. Do you know what I mean? I feel a bit worthless and a bit silly.
OK. We could look at it a different way round, though, couldn't we? Think about your body a bit like a car that has to be serviced. It's got to be looked after. It's going to go wrong from time to time.
Yeah, true.
So you take it to the garage.
Yeah,
and the garage has a look, has to do some tests. And then they'll come and tell you, they say, well, look, actually, there's nothing really seriously wrong. It's just a little bit of a loose this, that or the other. Or they might say, unfortunately, there's lots wrong and you're going to need to buy a new engine or whatever.
Yeah.
It's hard to imagine the rest of the body behaving normally if up here is in a turmoil.
Yeah, I feel low and down sometimes, and I think...
Yes.
Well...
And I think that that's one of the reasons we thought you might want to try an antidepressant.
Yeah.
Stress and depression are the bread and butter of our work. Very common indeed. And stress can be very important in many different illnesses. If I'm looking at a condition that somebody has, I might say, yes, this is the physical condition that they have, but what about the psychological element that could be making it worse? This headache, this migraine, if you like, it's the way your body is showing that it's under stress. But what we've got to try and address is what's causing it in the first place.
The underlying thing, yeah. It's just been everything.
Just keep talking to yourself and say, look, I haven't got anything to worry about at the moment because we don't know the facts.
Yeah.
So put that bit of anxiety in an envelope.
Seal it up.
And seal it up. OK? And concentrate on what is working well. I can do this, I can do that.
I mean, I feel quite fit, do you know what I mean? And I
yes.
think, well, I'm going to be 69 this year and I still feel quite good. Do you know
Absolutely.
what I mean?
Keep on with that.
Whatever I'm doing quite right.
And try to just sort of enjoy what you're doing.
Yeah.
Try to wallow in the good things in life.
I've got to try and fill every day with something that's going to be beneficial to me, even just going for a walk.
You've got to do things that are going to make you happy and that you enjoy.
Yeah. Not bar of chocolate.
Yes, what a good idea.
Yeah.
Now, can you keep still and let me do your blood pressure, do you think? Oh, yes, I mean, this is definitely stress, isn't it? Right. These little tablets you take for the sick feeling, right?
Yeah.
And I'm proposing we give you the slightly stronger cocodamol to take, right? I hope you feel a bit better sooner, and I hope it's helped to have a little chat about things.
Thank you, Jan. I'll make an appointment next week to see if these have helped me as well.
Yes.
Thank you very much.
OK, bye.
Bye-bye.
How are you today, sir? You're feeling particularly low at the moment.
How have you been in yourself?
I'm trying to cope, but still, because it's still the same.
Mm-hmm.
Is it hard?
Sometimes.
Yeah.
Yeah,
Okay.
sometimes.
What's happened recently to make this the worst day of your life? Okay. Well, look, I'm booking you in for an appointment at 3:40. You're not a hypochondriac. Take care. Bye-bye.
Now, he can be a bit squiffy for a few days with this, all right? So if he's a bit loose, don't worry.
You've got such a hard life.
Oh. Right, so sit him like that, nice and relaxed, yeah?
Yeah.
Okay.
I'm trying to be.
Well, you're doing very well.
Right, I'm not going to look. So
No,
tell me
just
when you're doing it.
Relax, just relax, okay? He's gonna...
My heart is beating.
It's all right. All right. You're doing well, you're doing well. So, there you go. It's all done, look, see? Oh. When somebody wants me to hold their baby for them, I can feel just as nervous.
Okay, have you got some tissue, please?
Yes, darling. Oi, mister. I'll get away with you.
All right, Mummy's sorry.
4 weeks' time.
Where's he got to get it done then?
He has his second diphtheria, tetanus, and his meningitis C. And
The
he
injection?
has, yeah.
Gosh, I can't do it.
Look, he's all right now. He's just whinging now. You're fine. Man up. Come here, give us a cuddle. What you like? What you like? Hey? I've always been able to communicate with children. You see them evolve, and one child, she wouldn't even come in the door. She'd sit in her buggy at the door, and I'd say to her mum, just leave the door open, that's fine, she can stay there if she doesn't want to come in. And then the next time she came in and she stayed in the buggy. And then I've met that child all the way through, and now she's an adult working, and I still bump into her, and we get on really well, and I've seen her develop as a child into a young woman, and it's great. Right, what time do you want? 9:30?
That's perfect.
Are you all right there, your hand down my cleavage, mister? My dog does that.
He does that all the time. It doesn't matter who it is, he does it.
We've got to let them develop. And that's what I love. I think they're so funny.
Thank you.
Are we going to get a smile before you go so your mummy knows you're all right? Look, he's fine now.
Did you have a problem with your medication? Uh-huh. Okay. Okay, you're welcome. Take care, bye.
Hello? I'm still limping. You're still limping, Ian?
Yeah.
Is it no better at all then?
No, it's not gone down at all with it. They phoned me up this morning, sir, can I come back to work today?
No, you can't come back to work.
They want me back this morning.
They wanted you back?
Yeah.
Come in. Hello. So, you mentioned the lump.
Yeah.
Let me see it. So whereabouts do you feel your pain?
It's around there.
It's around there?
Yeah.
OK. It's been a little over 2 weeks now, and the pain's no better at all. If you come lie down, I can work out whether it's your hip or your knee that's causing the problem. Right. So, bend your knee for me. Hang on. Relax. Just relax. Let me move your knee. Can you bend your hip a bit more as well?
No.
Does your hip come up any higher?
No, that's how high it comes up.
That's as high as it goes. All right. Does that hurt?
Yeah.
Can you sit? Can you sit on the edge of the couch? Might be easier if we get you to sit. Great. That's right. Just. Oh, does that hurt? Sorry. There you go. Let's get you up. Sorry. Didn't mean to cause you discomfort. I think the problem's your hip, Ian. Because your knee seems to be moving quite well.
Yeah.
And it's your hip that's actually really struggling to get much movement out of.
Yeah.
Would you agree with that? Or?
Yeah, yeah.
I think maybe we should get you referred to see the specialists about your knee and your hip.
Right.
All right, Ian. Yeah, do you want a tissue?
Right.
I take it you're not too keen on the idea of having to have further operations?
Oh, I'll be right. Last time I said it was 50-50.
Hello, it's Dr. Parker here at St John's Medical Centre. Right, he said he did want to have counselling, and I genuinely believe he hasn't been taking crack since then. He still takes cannabis, but then a third of the people that live around this surgery take cannabis, so that's nothing new.
Okay, but it's really important you try and avoid the marijuana. The strong stuff or the weaker stuff, it's still best to try and avoid altogether. Okay, take care. Cheers, bye-bye.
If you want to try to avoid an operation, then the thing to do instead would be to have some physio and seeing if that helps.
Yeah.
But unfortunately, arthritis tends to be progressive. It tends to get worse with time anyway. So, I mean, would you like to try some physio first, or do you want to be referred for...
I don't mind being referred to see the doctor again.
You'll see the doctor about maybe having the operation?
Yeah. Can I go back to work yet? Or not?
At the moment, do you think you'd be able to manage the pain?
No. They wanted me back this morning.
I know. Maybe if we give you a couple of weeks more off, and that gives enough time for hopefully the knee and the hip to settle down a bit more.
They want it straight away, they said. They won't get paid otherwise.
We'll take that then, quick. So that covers you from the 10th up until the 24th.
Yeah.
Yeah, I'll get the paperwork sent off. I'll ask them to see you as soon as possible. Okay?
Yeah. Bye-bye.
Bye-bye. Take care.
See you later.
Bye.
What's happened then? Hi there. What can I do for you today?
Yeah, basically what it is, Doc, I'm a diabetic, so, you know, my levels have been quite high, and I think I might have a urine infection.
All right. How high is high on your sugars right now?
22.3.
Okay. And where do you normally sort of run at?
Well, normally they run at about 5 or, 6, I mean.
Yeah, so they really have shot up.
Yeah.
You've had quite a few urine infections, is that right?
Yeah, on and off, yeah.
Okay.
Yeah.
What are the symptoms you've been getting?
Just like a burning sensation,
It burns?
Yeah.
Okay. And are you peeing more often than normal?
Yeah, more often, yeah. Just continuously all the time.
Right.
Yeah.
Okay. Have you seen any blood or anything in
No,
it
it's
at all?
not blood.
Right.
It's not blood.
Any cough or
No.
difficulty breathing, headaches?
No.
Rash?
No.
Nothing else like that? Diarrhea?
No.
Bowel habits fine?
No. Yeah,
Okay.
they've been all right.
I think the first thing I'll do, if you don't mind, is just dip the urine.
Yeah, sure.
Wait and take it from there, okay?
Yeah.
There's a lot of glucose in your urine,
Yes, sir.
but there isn't much evidence that there's a nasty infection going on. You shouldn't really get a significant burning sensation from just sugar, but I think going to the toilet a lot, going to the toilet very often, is classic of your blood sugar not being very well controlled and being much too high right now. I think we need to get your sugars better controlled, and I think that's going to mean cranking up the insulin slightly. I think we should go to 12 in the morning and 10 in the evening. And I think we should see you early next week with the results of the urine sample to make sure we haven't missed any infection. Although it doesn't, I don't think that's what's happening.
Right.
All right?
Okay.
Okay.
Okay, yeah.
Take care.
Okay.
Nice meeting you.
So I just need to examine her.
Yeah, that's fine. Hello, cheeky.
Think of the 3 pigs And the wolf outside going, huff, puff, blow your house down. That's the house. In. Get out of it. Try again, go on.
And if you were going to score it, say, 10 being the worst pain in the world, like having your arm ripped off by a lion, and 1 being like bitten by an ant, how would you score it?
10.
This pain in your stomach is as bad as having your arm being ripped off by a lion.
Easy.
That's it. Well done. Well done.
Hello.
Yeah, please. Jordan, this way. Jordan, no, this way.
What's up with Jordan today?
Right, I've just got a little problem. Is Ray's behaving? I'm just wondering, has he got some form of autism? I was reading on the internet that kids that line their toys up, line up their toys, because he does it like all
Lining
the
up the
time.
toys. Okay.
And he knows all the planets. You know, he just lined them up. Jordan, no, come this way. Jordan.
Okay.
Sit down. Okay?
What else?
And sometimes he's like this, he just laughs unconditionally.
No.
Jordan, can you stop?
And how does he get on with the other kids his age?
Fine. Teacher said he's fine. You know, Jordan, can you stop, please?
If Jordan wants something, can he tell you about it? Can he tell you, I want this
Yeah.
book, I want that book, I want to watch this, I want to do that, I need something to eat, I need something to drink?
Yeah.
I mean, you're right, autism is a spectrum. It goes from very severe to barely noticeable, to be honest. What you described about being quite obsessive about one thing, yeah, that ritualistic behaviour of lining things up. Yeah, those are 2 features of autism.
Yeah.
But there's also features of normal 5-year-old kids as well. Okay. The internet has a really interesting role in healthcare. I think once people have their diagnosis, it's very easy for them to then go away and research what the treatment options are themselves, and that's great. I really welcome that. I want my patients to be really well informed about their conditions. But I think the one thing that the internet's not very good at is diagnosing. Usually if a patient has tried to diagnose themselves on the internet, I'd say 9 times out of 10, they're probably wrong. Autism is a social communication disorder. It's your inability to be able to interact and socialise with the world around you.
Yeah.
It sounds like he does fine.
Yeah.
To line up the toys, that's every kid does that. Lots of adults do that. We all line things up just because that's the way we are.
Okay.
It doesn't make us autistic, it just means that is a little idiosyncrasy of some people's behaviour.
Yeah.
He seems like a pretty normal
5-year-old.
to me.
Okay.
All right?
Thank you.
No problem.
Jordan, come on, time to go. So thank you to Doctor. Thank you.
Bye-bye.
Bye.
It's time for the weekend.
Right, I've put that in for you. You're welcome. Okay, bye.
This patient was so happy that she got an appointment at the time that she wanted. But she goes, oh my God, thank you, darling. God bless you.
What are you doing this weekend? Watching my TV with my teddy bear.